It's a huge question, isn't it, to think, will we ever get to grips with addiction? Addiction will always be part of the human condition. So there's no question about that. So we have to make peace with that reality. We have to realize that we can't enact a policy that will rub away addiction. Pointless to even have a discussion or a debate on that basis. Meaningless, in fact, because the human brain is vulnerable to changing mood and behavior, and drugs provide a very easy sort of superhighway to achieve that. And they'll always be here. There may not be drugs that are derived from plants. We may, in future generations, stimulate the brain in other ways, but that isn't the point. So it is a fundamental part of the human experience. What we can do, though, I think, is make peace with the kind of inflamed nature of the debate in some quarters of society. We have to realize that no one sets out to be addicted. Very few people actually embark upon a path of sort of destructive behavior. What happens is small changes occur for a person, little nudges, if you will, that just push that person towards a much more ingrained pattern of behavior that becomes more and more dangerous for them. And perhaps because of the way we're so worried about addiction and that, in terms of laws, we disapprove, it does mean that individuals become more likely to be marginalized and in contact with the criminal justice system. And that's perhaps a unique aspect of addiction that isn't seen in perhaps other areas of kind of mental health so much. But we have to realize that there is a way forward. Now, it's based on giving members of the public who have, I think, a very deep appetite and thirst for reliable, factual, scientific information. So we mustn't pull our punches. We must speak accurately and clearly about the dangers of addiction, because these drugs are addictive. They really are. And if you become addicted, it is not easy to stop. So having said that, we then, I think, we are ethically required, I think, to then tell it straight about treatment. And the truth of the matter is that treatment works. It may need a number of goes. A person may need a number of episodes to get lasting remission, but it's there, and the NHS is the place to get the best quality and effective treatment. I think that when I've read the tea leaves about the next 20 years of research and practice for us, I've got a very clear picture in the bottom of my cup, which I'm pleased to share with you. I know it's a very risky business, prophesizing what's going to happen, but I think lines of research and clinical practice are coalescing today. The first thing to say is that we know that many medication therapies and many behavioral therapies don't work for some patients. In fact, most medication works for a minority of patients. We also know that there are certain aspects of individual preference and certain aspects of the way we can match services to individuals that are beginning to shed light on how we can personalize treatment. So that's what I think is going to happen going forward. We're going to be taking the sort of therapeutic tool chest apart, and we're going to be taking techniques and methods and supports and blending that to the individual's needs and preferences. And perhaps also using the knowledge that we're gaining now from molecular biology to basically profile the sort of genetic characteristics of an individual and personalize medication and behavior therapy based on the genetic makeup of the patient. Now, all of that's fairly fantastic at the moment. It sounds like a big claim that it's going to generate better outcomes, but I'm absolutely certain that it will.